Thank you, Dr. Lee, and thank you very much for organizing this wonderful meeting, especially for the Professor Lee. And Professor Kim, today I'd like to show you some example development of research by using superflexible half replica of complex congenital disease as a simulation surgery. Recent advances in diagnostic modalities from 2D, like X-ray, angio, and echocardiography, to 3D, MSCT, MRI, have provided realistic spatial information of CHD from any perspective view. However, still some sort of discrepancy remain between the 3D barometric images, especially VR images, and the real anatomy of the heart. If we make a patient-specific heart replicas with real anatomy and texture, it could be, or it should be able to improve the outcome of the heart surgery. I'll show you some example. This is a very complex DORY patient after the RVP anastomosis of the CT data. It's very hard to imagine the outer, the whole image of the heart. But if we make a 3D printing, if we use a 3D printing machine and make an outer layer, real myocardial layer of this case, it is very easy to understand the outer and inner structure of the heart like this. So there are several various types of 3D printing equipment machine. The first one is stereolithography. This is an oldest 3D printing technique, which is very precise, but the machine is pretty much expensive. The second one is huge deposition modeling, and this is pretty much easy one. And selective laser sintering and plaster 3D printing, and inkjet 3D printing machine. This is stereolithography, FDM, SLS, and inkjet printing. So to make the 3D printing model very accurate, we use the two accurate model of the 3D machine, stereolithography and inkjet 3D printing. The first of all, we made the 3D printing replica using stereolithography. So in 2006, we made a plastic, very hard model of the congenital disease of right isomerism, single ventricle, and TFC, and hypoplastic left heart syndrome. The anatomy of this complicated structure was pretty much reproduced accurately. But we are not able to make the simulation surgery because these models were made of plastic, very hard model. Sorry. So next, we make stereolithography with elastic hard model resin. So at the time, we are able to do the simulation surgery like this, but the material is limited because we need to select the photosensitive resin or urethane. And this one is not so perfectly flexible. So it's very hard to reproduce this cut and stitch by surgeon. So then we next tried to make the 3D printing machine, a 3D printing model with stereolithography followed by a vacuum casting method. After making stereolithography model, we put the this model into the polyurethane, and then makes two different types, outer and inner cast of the plastic model. Finally makes the polyurethane very flexible congenital disease model. So we are able to do the simulation surgery by using cutting and suturing, like this. So what is the indication of such kind of superflexible heart replica? Maybe RV anatomy is very complex in congenital diseases, such as the tetralogy Fallot or the DRV. So DRV, particularly with remote type ventricular septal defect, is a very good indication for such kind of simulation surgery by using 3D model. And another good indication is congenital cortical TGA for double stitch operation, and also RVOT obstruction and aortic anatomy abnormalities such as interruption or coaptation or hypoplastic retinal syndrome or subaortic stenosis or HOCM is also the good indication for the model. And final good indication is a ventricular septal defect with sort of multiple large VSDs like this. And also single ventricle, including AVSD with unbalanced ventricle to make the decision of the single ventricle or double ventricular repair. So this is a very excellent paper from the Professor Yo's group in Toronto. So, they reported the good indication for the 3D printing model for the double artery right ventricle. Probably we will be able to study by his lecture later. Last year we published a summary of the 20 cases. We already make a 3D printing model more than 100 cases, but in these 20 cases, we are able to do the good surgical simulation in the RV, especially for remote type VSD and congenital cortical TGA for double stitch operation and hypoplastic retinal syndrome and tracheal atresia with TGA. This is a detail of the simulation. This is the case of the DRV with remote VSD. We make the surgical simulation. We did the surgical simulation by using this model. We are able to, design the internal condyle of this case. And also, this is very unusual case of double ventricular right ventricle with outflow-tract large VSD and perimembranous VSD. So we are not able to do the surgical operation as a neonatal period. So we did the pulmonary artery banding, and then at the age of 1, we did the DKS and RBPA condyle surgical operation. He's now doing very good after 2 or 3 years after the surgical operation. So we have to do the clinical study on evaluation of such kind of suprafloral heart replica. This is just a very simple clinical study by cardiac evaluated by cardiac surgeons. So what is the reliable size for simulation? Ventricle is not so good, but it is okay. Artery is pretty good, okay. But whole perspective, whole 3D anatomy is very good. Highly evaluated in this case. And over-availability operation, sharing information, and safety of the surgery, and education for the trainee. So in those points, these simulations are very good worked for the surgical operation. However, avoiding the operation is very hard to decide, because it takes 5 or 10 years to get this long-term prognosis in these cases. So the similar discussion, similar paper has been also published in the European group. Those 3D models are highly evaluated by surgeons and pediatric cardiologists. And another very important point is that validation of the replicas which we made. So we evaluated this model by using the industrial-based 3D CT in a kind of non-destructive inspection method. So green, shade color green indicates green or blue indicates good coincidence between the 3D images of the modeling of the 3D model between and original 3D CT data. So you can see here almost all the areas blue or light blue indicate that most of the sites of the models are pretty much coincident with the original data. So we chose just 10 cases, and most of the average error of the original data and the 3D printing products were less than 0.54 millimeter, which is, I think, pretty much reliable because most of the surgeons usually suture or cut in 0.5 millimeter of order. So this means this model is pretty much good for the surgical simulation in a clinical field. But there are several problems of stereolithography followed by vacuum casting. It takes at least 4 or 5 days to manufacture hard replicas, and $2,000–3,000 per model, expensive. And of course, it's very hard to reproduce fine structure of the heart, for example, valve leaflets and cord. So next, we developed a new UV-based inkjet 3D printing system exclusive for reproducing human cardiovascular system. And this machine allows to reproduce heart replicas within just 2 days. And less than 50% amount of cost, like still it costs like $1,000 per model. This is method of this inkjet UV-based inkjet 3D machine. This is a machine we made. It cost almost $1 million. But we are able to get a very flexible. This is a little bit wet type. We have to soak this model in water, and but we are able to reproduce a very accurate 3D structure from the autopsy. This is an autopsy heart scanned almost 30 minutes. Very soft and wet. I have a sample right here, and I'll show you later. So I'll show you some example of the simulation surgery of the tetralogy furrow. In the case of tetralogy furrow in adult case, after the BT shunt. This is the aorta, the pulmonary artery. He's going to cut the right atrium. Then this is a kind of fake tricuspid valve we make after the 3D reconstruction. This is an aortic valve, and this is a bent VSD through the tricuspid valve. And he's going to cut the stenotic pulmonary artery trunk. And this is a very small pulmonary artery. Pulmonary valve and subpulmonary stenosis, very narrow. He cut the arterial tract and RVOT tract, and then enlarged the RVOT tract. We also make a training model for the young surgeon. This is a training model, very cheap, like $100. Good for the surgical simulation for the Japan operation for complete transformation of the great arteries. Sorry, it's in Japanese. So the present and future application of those super flexible heart replicas, we are able to make the do this surgical simulation successfully, and we make the mitral valve model for mitral valve clipping, and we also make the model for the Da Vinci robotic surgery and such on. And those equipment usually probably will be able to contribute the tailor-made treatment for each patient in complicated congenital heart disease. And finally, in combination of AI technique, lifelong simulation of congenital heart disease patient will be performed in the near future. And this is the conclusion. Combination of stereolithography and vacuum casting and ultraviolet-based inkjet printing techniques are idealistic method to reproduce fine structure and texture of complicated congenital disease. These biomodels provided us better understanding of 3D anatomy, education of medical training, rehearsal of surgical operation, development of non-invasive surgical procedures. However, further improvements and advances are necessary. For example, getting better image quality and reducing the time and cost of manufacturing to become more beneficial for patients with congenital heart disease. Thank you very much for the attention.